What is medial cleft? It is irregular air-filled space within the temporal bone. It consists of 6 components. Medial cleft starts from lateral wall of the nasopharynx, where opening of the Pharyngotympanic Tube, which is located as tubal elevation, from where it starts as Eustachian Tube or Pharyngotympanic Tube. Second part is medial cavity proper, then otic, then aditus, antrum, and mastoid air cell systems. So there are 6 components of medial cleft. Now development of medial cleft. You have to remember 2 important things. One is it is developed from first arch and second arch. 2 branchial arch it develops, an otic capsule. From first arch endoderm. What is endoderm? There are 3 germinal layers. You already learn in embryology. One ventral layer is endoderm, middle layer is mesoderm, and external layer is endoderm. So it first does endoderm, that is Eustachian tube, tympanic cavity, otic, antrum, and mastoid air cells are developed from endoderm. First arch mesoderm, that is the malleus and incus. This is medial ossicles. Malleus and incus is developed from first arch mesoderm. Now second arch mesoderm, from where is developed stapes. So all the 3 ossicles of the middle layer are not developed from one single mesodermal element. It develops from 2 mesodermal elements. From first arch, malleus and incus is developed, and from second arch, it is actually suprastructure of stapes. It should be written as suprastructure of. Now otic capsule. Otic capsule is nothing but, this is otic capsule. It developed from ectodermal and is detached from the ectoderm. It goes migrated deep inside this color. It is the otic capsule, from where develop foot plate. It is the stapes. It is foot plate and the annular ligament. Annular ligament is nothing but stapedovestibular joint. It is fibrous type of joint. You already learned there are different types of joint: ball and socket joint, synovial joint, fibrous joint. Know it. So it is fibrous type of joint, vestibulo-stapedial joint. So it developed from otic capsule. Now middle ear proper. Middle ear looks like your lecture hall, like this. Suppose this is your middle ear. So your room has 6 walls, front, behind, 2 side wall, and roof and floor. Same roof, floor, anterior wall, posterior wall, medial wall, and lateral wall. So it is a 6 wall box. Now how it divide the middle ear? It divide by epitympanum, mesotympanum, hypotympanum. Look at this picture and this picture, 2 picture. It is a biconcave. Cavity is biconcave. Minimum diameter in the middle. Maximum is epitympanum. That is the upper part of the, that is roof. Roof part is the largest. 4, 2, and 6. This is the attic part. Why it is large? Due to lodgement of head of the malleus and body of the incus. 2 ossicles heads are there. This, from this to this, It is the tympanic membrane. This red one. This is the fibrous annulus. And this elevation is promontory. That's why this is the cause for narrowness of the middle part. This part is narrowest. And this is hypotympanum. This is hypotympanum. So there are three segments in the middle ear: epitympanum, mesotympanum, and hypotympanum. Anterior wall. Anterior wall of the middle ear, upper third, middle third, and lower third. From upper third, anterior tympanic sinus. This is the anterior tympanic sinus, this space. Middle third, canal containing tensor tympani. This muscle is tensor tympani. Then orifice of the Eustachian tube. This is the Eustachian tube orifice. And then the lower third. Lower third, superior inferior carotid-tympanic nerve carrying the sympathetic fibers and tympanic branch of the internal carotid artery. These two. So there are entrance, E, T, A, and C in short. Now posterior wall. Posterior wall, there is a communication in between the epitympanum and mastoid cavity by a canal that is called aditus and antrum. That is called aditus and antrum. This is the aditus and antrum, this area. Then fossa incudis. Just below this aditus, it is fossa incudis. It is nothing but a depression to lodge the posterior process of the incus. Then pyramidal eminence. This is the pyramidal eminence. This body elevation. Okay. Now facial recess and sinus tympani. These are the nothing but some depression on the posterior wall just below the pyramid. This is pyramid. Facial recess is very important surgically. It is bounded laterally by the fibrous annulus and chorda tympani and medially by pyramid and facial nerve. What is the surgical importance? Through which posterior tympanotomy is done and through which your cochlear implant is that is the posterior tympanum is the window through which cochlear implantation is done. Then sinus tympani. This is the part medial to the pyramid and facial nerve. What is the surgical importance? Residual cholesteatoma sometimes lodged in this area. Sinus tympani is a hidden area in which cholesteatoma material or epithelium or granulation tissue may lodge inside this. Now roof of the middle ear, that is called tegmen tympani plate. It is a thin plate to form the both petrous and squamous part of the temporal bone. It is we already know there are different components of the temporal nerve, temporal bone. What are the components? Anatomy পড়েছে তো? না, হয়নি। Temporal bone anatomy? জানো? কেউ জানো? What are the different components of the temporal bone? Petrous part, squamous part, tympanic part, styloid part. মনে পড়ছে কিছু? So roof is formed by two bones. One is petrous part, one is squamous part. But very thin plate of bone separating the temporal lobe. So it is the temporal lobe. This thin plate of bone is tegmen. This is the middle ear space. Okay. So petrosquamous suture line may be present in case of children. What is the surgical importance of this dehiscence petrosquamous line? This surgical importance is a single otitis media in children may lead to meningitis. Direct continuity of the medullary infection with the cranium through the dehiscence. Infection easily spread inside the brain, giving rise to otitis media with meningitis. Actually, it separates the middle cranial fossa from the middle ear. Now, floor. Floor is formed by thin plate of bone, what is called fundus tympani, separating the dome of the jugular bulb. This is your floor, this is jugular bulb. Jugular bulb lying posteriorly and internal cavity artery lying anteriorly of the floor. Dehiscence sometimes covered by fibrous tissue and mucus only. This floor may be dehiscence due to the jugular bulb area, giving rise to likely to be injured during the middle procedure. Tympanic branch of the glossopharyngeal nerve passes through this floor. Glossopharyngeal nerve, tympanic branch. Medial wall. This is very important. তোমাদের শর্ট নোট কিন্তু পরীক্ষা আসবে মিডল ইয়ার। Draw the middle ear and describe. You can see there are 7 pieces of windows. This is oval window. This is round. This is oval. This is oval window. This is round window. This is 7th cranial nerve, yellow one. This is 7th cranial nerve. This is promontory. This elevated area is called promontory. It is formed by the basal turn of cochlea. Formed by basal turn of cochlea. Processus cochleariformis. This bone is called processus cochleariformis. What is the significance of processus cochleariformis? This is tensor tympani muscle. It arises from the anterior wall and it hooks to insert in the neck of the malleus. So it changes the direction by this hook. This is called processus cochleariformis. Ponticulus and sibiculum. Ponticulus and sibiculum. This is the here there is the ponticulus. There is bone here above the round window. There is a bone. This is called ponticulus, and there is a bony ridge in front of this round window, that is called sibiculum. Tympanic plexus located over the promontory. There is a plexus called tympanic plexus. It is called over the promontory. Lateral canal, lateral semicircular canal. This is the lateral semicircular canal. Lateral semicircular canal of the labyrinth. There are 3 semicircular canal, anterior, superior and lateral, to maintain the angular orientation of the person. Epithelial lining. Cartilaginous part of the Eustachian tube is lined by ciliated columnar pseudo-stratified type of epithelium. As it is ciliated, there is self-cleansing mechanism is there. Ciliated columnar, bony part is ciliated columnar protympanum. What is protympanum? It is the anterior part of the middle ear. It is called protympanum, adjacent to the Eustachian tube opening into the middle ear. Non-ciliated flat cubital. So there is no cilia. There is some pathological significance I will teach you later. Epitympanum and mastoid ear cells. Epitympanum, that is the roof part of the middle ear, that is non-ciliated columnar epithelium. Now some spaces of the middle ear. Middle ear is ventilated through the Eustachian tube, you already know, and there are different pockets through which ventilation is done. Now, Spusak space. What is Spusak space? This space is called Spusak space. Laterally, it is bounded by pars flaccida of the tympanic membrane. Above, medially by neck and superior malleolar ligament. Now, isthmus tympanic anticus. This is isthmus tympanic anticus. This is isthmus tympanic posticus. Anterior pouch of von Trotz. This is anterior pouch of von Trotz and posterior pouch of von Trotz. Through this gap, the mesotympanum, through the mesotympanum, air goes into the epitympanum. Thereby, epitympanum is ventilated by the mesotympanum. It is not directly ventilated by Eustachian tube. It is ventilated through the mesotympanum, through this narrow isthmus. Mastoid antrum. This is air-filled space in the petrous part of the temporal bone. So, mastoid antrum is located in the petrous part of the temporal bone. Anteriorly, it communicates with the epitympanum through the aditus. I already told you. Posteriorly, other cell system. There are periantral cell. Plenty of cells are there. Roof is tegmen antri. Medial is tegmen tympani. The name of the roof over the medial, tegmen tympani. Here, same plate of bone, name is different. Lateral suprameatal triangle, a boundary জিজ্ঞেস করে পরীক্ষায় কিন্তু McQueen's triangle, 1.5 centimeter deep to the surface. Mastoid antrum is located. The surface marking of mastoid antrum, McQueen's triangle. Mastoid air cell system. There are different air cells along the all are ventilated through the mastoid antrum. What are the cells? If it is plenty of cell, there are three radiological type of mastoid. These are three radiological type. Well-pneumatized or cellular. There is plenty of cell in the mastoid. That is called cellular mastoid. Diploic means 50% less, 50 to 60% less cell in the temporal bone. Sclerotic, no air cells except mastoid antrum. Mastoid antrum is the permanent and persistent cell. It never disappears. It always there. Mastoid antrum. That is, mastoid antrum is also a cell. These are subdivision of the cells in case of cellular type of mastoid. Okay. There are different distribution. Zygomatic. This is zygomatic process. Along this process, there is plenty of cells. This is called zygomatic group of cells. Petrous tip. It cannot show here. It deep inside. Peritubal. Along the Eustachian tube, that is called peritubal cells. Retrofacial, just behind the facial nerve, this area. Retrofacial cells. Periantral cell, around the mastoid antrum, that is called periantral cell. Mastoid tip cell, this is the mastoid tip cell. Perisinus, this is sigmoid sinus. Around the sigmoid sinus, there are plenty of cells are there. That is called perisinus cell. Synodural angle. This is synodural angle. This is called synodural angle cells. Squamous cell. This is squamous part of the temporal bone. Sometimes it is so pneumatized, it goes into the occipital bone also. So, what is the utility of the pneumatization of the temporal bone? Sound perception, resonance. As there is air filled in the mastoid bone, there is resonance of the sound. Insulation for heat. You all know air is bad conductor of heat, so we act as a insulator. Supplementary air reservoir. If there is crisis of the air inside the middle ear, they can supply the air. Sound dissipation, Lightening of the skull, there will be skull weight is less due to pneumatization. Protection against injury. Now, Eustachian tube. It is also called Pharyngotympanic tube. You can see it is the cartilaginous part, it is the bony part. Okay. It is 36 millimeter long. Direction is downwards, forwards, and medially at 45-degree angle from the middle ear. If it passes through the middle ear to the nasopharynx, the direction will be like this. Bony part, outer 1/3, already told you. Fibrocartilaginous part is the inner 2/3. This is the inner 2/3, it is the outer 2/3. Isthmus is called, this is the narrowest part, is called isthmus. There are three muscles related with the Eustachian tube: tensor and levator. Veli palatini, tensor palatini and levator palatini, and salpingopharyngeus. There are three muscles related to the Eustachian tube to opening and closing the Eustachian tube. Elastic hinge. This cartilage is a elastic type of cartilage, incomplete cartilage, just like comma, and other side is closed by a fibrous membrane. Lining, ciliated columnar epithelium, already told you. Function, ventilation, protection, drainage, and gaseous exchange. So, Eustachian tube functions are 4. These 4 are the Eustachian functions. Clinical importance, it is important in case of children because in infant the Eustachian tube is shorter, length is shorter, broader, and more horizontal. So, chance of ascending infection from nasopharynx is very high. That's why in case of children, acute otitis media is very high in case of children. More chance of ascending infection, barotrauma, and patulous Eustachian tube. Content of the middle ear. What are the content? Actual content is air, because all ossicles, all these things are extramucosal. These structures are lined by mucous membrane. So, actually content is air. Ossicles are 3 ossicles, already told you: malleus, incus, and stapes. There are 2 muscles, tensor, tympani, and stapedius. And there are 2 nerves. One is tympani nerve and another is tympanic plexus. So, 3 ossicles, 2 muscles, and 2 nerves. Okay. Now, ossicles. Malleus, largest one, 9 millimeter. Component, head, anterior process, lateral process, and handle. This is the malleus, this is head, lateral process, long process, neck. This is incus, this is head, this is long process. This is stapes, this is foot plate, anterior class, posterior class, neck, and articular surface. This is the joint, malleoinguinal joint, it is inguinostapedial joint, and here vestibulostapedial joint. This is synovial joint, this is synovial joint, this is fibrous joint. This joint is fibrous, different. Okay. Muscles. Tensor tympani muscle, already told you, arising from this component, bony canal above Eustachian tube. Above the Eustachian tube, cartilaginous part of the Eustachian tube, greater is sphenoid, attached to the neck of the malleus. It changes direction by process as cochlear furnace. it coming from anterior to posterior, then it turns back to the lateral, outside. এসে এবার ঘুরে যাচ্ছে, ঘুরে in the medial aspect of the neck of the malleus insert করছে, ঠিক আছে? Function কি? It tenses the tympanic membrane, nerve supply by the mandibular nerve. Stapedius is the smallest muscle in the body. Stapedius is the smallest muscle in the body, just above 1 millimeter in length, arising from the pyramid inserted in the neck of the stapes. Nerve to stapedius is a different nerve. Before I told you, tensor tympani is supplied by mandibular, but stapedius is supplied by facial nerve. Function: dampen the vibration of the stapes, control the amplitude of sound wave. You will learn in physiology stapedial reflex, and stapedial reflex is due to a contraction of the stapedius muscle on supra 80 dB, above 80 dB of sound. If there will be contraction of the stapes muscle. Tympanic plexus is formed by tympanic branch of the glossopharyngeal or Jacobson nerve, carotid-tympanic branch of the internal carotid artery. It is situated over the promontory. It's promontory. This is promontory. From below, Jacobson nerve, from anterior, carotid-tympanic branch of the internal carotid artery. It supplies the sensory mucous lining of the tympanic cavity tube and mastoid antrum. All the inner lining is sensory supply is done by tympanic plexus. Secretomotor fiber via laser petrosal sinus, tensor tympani muscle and parotid gland. Secretomotor supply is go through this plexus. Importance: what is the importance? Tympanic branch and is excised in Frey's syndrome. Tympanic branch is excised in Frey's syndrome. Jacobson nerve is excised in case of Frey's syndrome. Refer otology from the pharynx. Coda-tympani nerve. It is the nerve of taste sensation from the anterior two-thirds of the tongue. Anterior two-thirds of the tongue is supplied by coda-tympani for special sense, that is taste sense. Arises above the stylomastoid foramen. This is stylomastoid foramen. So it arises from facial nerve, goes above like this, enter middle ear through posterior canaliculi, runs medial to the lateral passage of incus and lateral to handle malleus. So coda-tympanic nerve passes in between the two ossicles. Okay, lateral to the incus, medial to the handle malleus. To join the lingual nerve, it is distributed through the lingual nerve. Taste sensation, anterior two-thirds, secretomotor fiber to the submandibular and sublingual salivary glands. This is the endoscopic anatomy of the middle ear. Endoscopic anatomy, you can see round window is. This is the round window. Okay. It is covered by secondary tympanic membrane. Okay. Oval window is covered by stapes. And this is covered by a thin membrane. It is called secondary tympanic membrane. This sinus tympani already told you where these are lodged inside. The front elevated area is cebiculum and above ridge is called ponticulus. I told you. Next. You can see this is handle malleus. Okay. This is tensor tympani muscle inserted medial aspect. This is called ambo. Tympanic membrane is tuned out. Tympanic bar kore deya hoyeche. This is incus joint here. This is the long passage of incus. This is incostapedial joint. This is synovial joint. Okay. This is pyramid from which stapedius tendon inserted behind the neck of the stapes. This depression is foot plate of the stapes, and this is the stapedovestibular joint. This is sinus tympani. This is the round window. This is promontory. ঠিক আছে? This is hypotympanum. This is hypotympanum. Next. This is round window niche. It's called round window. This is surgically important, through which the cochlear implant electrodes are passed through this area. This is ponticular cebiculum, already told you, sinus tympani. Next. Round window niche, promontory, sinus tympani, pyramidal eminence, stapedius tendon. This is the head of the stapes. Next. This is cauda tympani nerve. We already told you cauda tympani nerve runs in between the malleus and incus. It is handle of malleus. Cauda tympani deep to the handle of malleus. This is this long process of incus, long process. Lateral to the long process. It passes through the anterior opening. This is the facial nerve, stapedius tendon, lenticular process of the incus. This is the fronticulus, cebiculum, anterior plus posterior. Next. তো হয়ে গেছে নাকি? হয়ে গেল সব শেষ নাকি? এটা দেখালাম মনে হচ্ছে নাকি? এটা দেখিয়েছি। This is the Jacobson nerve. This is the promontory area where tympanic plexus is formed. This is the Jacobson nerve, you can see, coming from the floor. Okay.